What's the point of going to a primary care physician if I can just go to the specialist myself?
In my humble opinion, the specialist is very specialized. They're specialized in the cardio or endocrine or whatever specialty they're from. What other specialty is there to kind of take a look at all that information, all the medications, put it in a blender, shake it up, look at it, and see cardiac plays with pulmonary, that plays with endo, that plays with mental health. Who's your quarterback for all of that? One analogy I like to use with my patients is that, hey, I'm your quarterback. I'm not the wide receiver, I'm not the linebacker. I know what they do, I know what they're here for. It's my job to make sure I'm calling plays that if we need that player or this player, that everything works well together.
Yeah, I love that football analogy. In soccer, maybe you're a defensive midfielder. You're passing out the ball, but you're also doing some protective things. I think that also, though, coming to us first is important sometimes so that we can do some tests and make sure that we're going to the right place. Just taking up physicians' time, especially specialists who maybe wait a year, maybe wait 6 months to see them, and doing nothing in that meantime. I don't know if that's beneficial for anybody. But seeing your primary care, we could do the testing beforehand for a lot of things. Maybe we could even start some treatment ourselves until you could see them. And that way you're not just waiting 6 months to a year.
I love that point as well. I think another point to echo off that is that we triage the patient. The patient may not always know that, hey, this discomfort is musculoskeletal, is it cardiac, is it pulmonary? It's our job, like Dr. Kouzov mentioned, to initiate the workup saying that does it fit through bucket A, bucket B, bucket C? Based upon that, we'll shift you in the right direction. Dr. Kouzov mentioned that specialists are few and far between, a very long wait period. When I refer, I'm sure Dr. Kouzov is as well, we don't refer lightly. It's for a procedure we can't do or a question we don't have. But the least we can do, let's start the workup so we don't fire off referrals blindly.
Amazing. So whether you're into soccer or football, primary care is still a pretty good idea.
For your first step, yes.
Yeah.